Hi, my name is Chad Oliveira and I'm a doctor of physical therapy and a therapeutic pain specialist. Did you know that there are 3 different types of pain? The first being what we all experience when something happens. If you bump into something, hit something, kick something, the nerves act like an alarm system and they send signals up to the brain to tell the brain that something just happened. If the brain takes those signals and decides that there is a problem, it turns on the alarm system. That is pain. So this type of pain is the most common, and it relies on something happening and then there being a response. So for instance, if you stub your toe up against something, that signal goes from the toe up to the brain, and the brain responds with turning on pain, saying ow, and you even withdraw from the stimulus. And all of that happens automatically. The pain is normally proportional and regional to where the incident occurred. Like when a crime is committed, the police go to where the alarm was sounded, where the incident happened. That's our first type of pain. This type of pain is what we would call acute pain because it happens in the moment, and this pain may last a couple of days or even a couple of weeks. It just depends on the severity of the injury and how sensitive your alarm system is. The second type of pain actually is damage to the nervous system itself, or damage to the alarm system itself. So when this happens, you can get a lot of weird sensations. You can get numbness, tingling, you can get sharp shooting pain, burning, throbbing pain even. All of these things are indicators that the nerve has been insulted or damaged in some way. The damage doesn't have to be big, it can be minor, and the nerve doesn't care. It's going to send signals like a warning system, trying to get the attention of the brain so that the brain does something to take care of this problem. In this fashion, I had a patient tell me a couple of weeks ago something that I really liked, which was my pain is like an angry child or an angry toddler. And that makes a lot of sense. As a parent, you have a child that wants your attention, and they're just going to go up to you and go, dad, 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 mom, mom, mom. And they're going to keep doing that until they get your attention and they get what they want. So the brain has to be the adult in the room on this particular scenario. The nerves, they're going to just send signals up. That's what nerves do. They send signals up whenever a stimulus occurs, and that could be a light touch, it could be a deep pressure, it could be a movement of the joint or an activation of a muscle. Whatever that nerve is sensitive to, it will send signals up to the brain, get the brain's attention. Now, once the nerve has the attention of the brain goes to work trying to figure out what's going on. And a lot of the times, the brain may not know what's going on. And we have people verbally tell us, I don't know how this started. I don't know what's going on. And I don't seem to be able to get a satisfactory answer or to get an answer. First 2 types of pain, they can be acute or they can be chronic. That's all just talking about how long this injury lasts. So acute pain is something that happens within the first few weeks of an injury. Chronic pain is any pain that lasts longer than 3 to 6 months for any reason. And chronic pain is a transition from this acute phase to something that's a bit more persistent and prolonged. And nerves, depending on the injury, nerves can take a long time to heal, just depending on the injury. Some injuries to nerves do not heal in a lifetime. The third type is the one where 1/5 of adults in the United States are affected by it. And with this type of pain, the primary driver is the brain itself. The brain has not, in some cases, the brain may have sustained an injury, but in many cases, the brain has not sustained an injury. The brain instead has had a angry child just trying to get its attention all the time, that it learns to respond with pain more frequently because experience tells it that it needs to respond more rapidly. And when we look at pain through the lens that it's an alarm system, then we start to see that it's a process that occurs. Something has to activate the alarm system. And then if the alarm system is never turned off, then the problem of pain will persist. And we are constantly learning. We're either learning something new or we're getting really good at the things that we already know. And that's where chronic pain comes into play. It's a coping mechanism that is learned by the brain. So our 3 types of pain are, the first one is your most common type. It requires a stimulus down in the body from something that it interacts with out in the environment. 2 is your nerve injury. Okay, we refer to this as a neurogenic, and it could be a nerve injury or it could be a spinal cord or brain injury. These can become chronic, and when they do, the brain is learning how to protect you better, and it's using pain and the alarm system to do that. There is a way to reduce pain for all of these scenarios, and the brain has an involvement in that. Most of the time, with the most common version of pain being the nociceptive pain, when we have that going on, the brain immediately just shuts it down. So the brain understands what the problem is. The brain knows it's not a big deal and just says, we're going to shut it down. We don't need this alarm on right now. We're not going to freak out. When the nerve has sustained a damage or the nervous system is damaged, the person can get confused and scared, and this oftentimes leads to a chronic pain situation where the pain has now changed from an acute injury to the chronic type. And this can be persistent for an indefinite time until the brain learns a different coping strategy. If you found this information helpful and you want to hear more, my plan is to put out a video a week educating about pain and what you can do to reduce pain. It is a process. It is not a light switch that you can just turn on and turn off. There are specific things that you can do and should do when you're experiencing pain so that your pain is less. Pain is normal, and we want it to behave in a normal way.